Hey, Dr. Mike here, and today I want to discuss a little bit of a fun thing, which is the 7 fun facts about your back. So, this thing is back here. Most of us don't even know we have a spine. I mean, we do, but we don't think about it because it's behind us. Not like our teeth, which is in our face, right? So we pay more attention to our teeth and the way we, maybe our appearance, but the spine is a very important aspect of our anatomy. And so let's cover these 7 fun facts. The first fact I want to talk about is that the human spine was meant to be vertical. And so most animals are down here on all fours, right? Every other animal on the planet, maybe with the exception of the great apes and the chimpanzees, but most of the time they're down here too. But we're vertical. And so the way our bodies are designed, the way God designed us, is that we have curves. We have a curve in the neck, we have a mid-back curve that goes the opposite way, and the low back goes the same way as the neck. And that's important because that's the reason that our spines can sustain longevity, is that those 3 curves exist. And that makes our spines very strong. Obviously from the back it's supposed to be straight, but from the side, 3 distinct curves. The second fun fact that I want to teach you guys is that the cartilage in between our bones is called the vertebral disc. And you've heard people have had disc herniations and disc degeneration and things like that. Discs are not necessarily meant for shock absorption or for gravitational forces, meaning they're not really meant for weight bearing. They do some weight bearing, but their primary purpose is to separate our bones so we can move. So they're basically spacers that allow these 24 bones to move. That's our next fun fact, is that there are 24 movable vertebrae in our spine, 7 in the neck, 12 in the mid-back, or what are called the thoracic vertebrae, and then 5 in the lumbar spine. So there's 24 total bones. There are 3 pelvic bones, and the pelvis consists of 2 ilium bones, which are the hip bones, and then the sacrum. The sacrum is considered our tailbone, which is the foundation of our spine. And really important, I had a pregnant woman here today who had a twisted or distorted pelvis, and the baby wound up being hung up in a breech presentation. So we actually have an adjustment to help that by creating balance at the pelvis. Pelvis is really considered the foundation of all the spine, and if it's crooked, the rest of the spine is going to grow to accommodate that, right? So that's the pelvic bones, and then we got the joints. So people talk about the noise that is heard during a chiropractic adjustment, and you hear that popping sound. So I want to explain what that is and what that means when you get adjusted. So for the most part, if you have a joint and you have, it's basically 2 bones and the joint is in the middle, and if we pull it like that, we create what's called cavitation. It's a release of air, nitrogen and CO2 bubbles. It just creates a little pop like that. Now, that bone and that bone has 1 joint in between it. It's going to make 1 noise. In the neck, each bone, each cervical spine vertebrae has 6 articulations. 2 at the top and the back, 2 at the bottom, and then the disc top and bottom. So there's 6 total articulations in 1 bone. So we could adjust 1 bone and have 6 noises come from that 1 bone. In the lumbar spine, it's the same. In the thoracic or mid-back, where you have your rib cage, you have a 7th and an 8th articulation where the ribs connect with the vertebrae. So 1 adjustment here in the thoracic spine can actually release 8 noises. So a lot of people are fascinated when they find that out because they're always concerned about, wow, why does my spine make so much noise when it moves? That's why. There's more than 1 articulation. There's 31 pairs of nerve roots, 31 that emanate from the spine. So you got your brain here, and the spinal cord hole is through the base of the skull, goes down through the spinal cord. And at every level, there's a pair of nerve roots. The nerve roots carry messages from your brain to your body. And they do that at the speed of light, which has been measured at 393 feet per second. And that's a fun fact. 393 feet per second is how fast your brain can send messages down to your spinal cord and how fast your body can send messages back to your brain. And that's important that it's fast, because if it's not fast, then we have malfunction. And malfunction's a problem. Like, for example, if you go to your friend's house and you put your hand on a hot stove and you don't have that quick speed what's going to happen? You're going to, hey, what's for lunch, and burn your hand. So what we want to make sure is that we have optimal speed of flow. 393 feet per second is how fast these nerves carry messages to every cell, tissue, organ, and system of our body. Very important. 31 pairs of nerve roots. And the last fact that I want to cover is that this thing is irreplaceable. In other words, there's no replacing it. Like, we have great technology in medicine now. We could replace hips. There's 2 great techniques they do. They do a new version, which is an anterior, which is less invasive. But we're really great at replacing knees and hips. Other joints like the shoulder are a little more complex, but there's no replacing this. You get one. We could replace our teeth. We could go in and get implants, or we could, my grandparents, 2 of them wore dentures. And I never knew them to miss a meal, by the way. But if this gets really messed up or neglected, there's no replacing it. And so I implore all my patients, take good care of your spine, because it's got to last you a lifetime. All right? So with that, don't forget, stay informed and get adjusted.